Neurology quiz number 82. Describe the clinical features of primary progressive aphasia or PPA. PPA refers to a group of neurodegenerative diseases characterized by number 1, early and prominent language impairment, number 2, which occurs in the relative absence of cognitive impairment, behavioral disturbance, or motor symptoms. Number 3, it usually occurs between the ages of 50 to 70 years with an average of 60 years. There are three types of PPA: non-fluent agrammatic, semantic, and logopenic. The first two are classified as frontotemporal dementia variants because of their tendency to involve the frontal and temporal lobes and their association with FTD pathology. The logopenic variant is viewed as an atypical variant of Alzheimer's disease. Criteria for diagnosing PPA: inclusion criteria. The most prominent feature is language difficulty. These deficits are a principal cause of impaired activities of daily living. Aphasia should be the most prominent deficit at disease onset and for the initial phase of the disease. Exclusion criteria: prominent initial episodic memory, visual memory, and visual perceptual impairments, prominent initial behavioral disturbances. Pattern of deficits is better explained by other non-degenerative CNS or medical disorder. Cognitive disturbances are better explained by psychiatric diagnosis. Non-fluent agrammatic variant PPA. Speech is effortful, slow, and sometimes telegraphic. Patients have apraxia of speech, which is an articulation planning deficit that can sound like stuttering or word pronunciation distortions. Agrammatism and word-finding difficulty or anomia are prominent. Use of nouns is relatively preserved, but patients make mistakes in tense or in the use of prepositions. Phonemic paraphrases are common, such as improper sequencing of syllables or incorrect phoneme use. Phrases are short, generally less than 4 words long. Comprehension is relatively preserved. Regional imaging abnormalities and pathological changes are predominantly seen in the left posterior frontoinsular region. Pathological changes include tau inclusions and less commonly TDP43. Genetics: up to 30% of patients with this variant of PPA may report a family history of neurodegenerative disease, but mutations are rare. Cases have been reported with mutations in the three main FTD genes, although at least some of these had associated behavioral, cognitive, or motor symptoms early in the disease course. This figure shows a case with non-fluent agrammatic PPA with degeneration in the inferior frontal gyrus and adjacent structures. This figure shows a surface projection of the typical patterns of hypometabolism in this condition, which typically affect the left frontoinsular area. This is an example of neuronal intracytoplasmic tau inclusions, as may be seen in this condition. Criteria for diagnosis: core features include at least one of the following: agrammatism in language production, which is predominantly an inability to use words and phrases to create well-formed sentences, effortful and halting speech with inconsistent speech sound errors. Supportive features include spared single-word comprehension and spared object knowledge. Prognosis: the speech difficulties worsen progressively, making communication difficult. Patients may become mute. Some patients may develop behavioral abnormalities and meet criteria for FTD. Such patients may also be at risk for developing motor neuron disease. Some patients can develop features of corticobasal syndrome or PSP. Median survival is around 7 years period. Semantic variant PPA: there is loss of word meaning, and patients may ask what words mean during conversation. For example, a patient will ask, "What is a chair?" after being told to sit in a chair. Nouns are typically most difficult, which may result in circumlocution. Example, saying "device" for moving around in place of a car. The use of a more general or category label. Example, "animal" for dog, or the use of non-specific filler words such as "thingy" or "what's it?" Fluency and grammar are frequently preserved, and patients may become hyperverbal. Regional imaging abnormalities and pathological changes are predominantly seen in the left anterior temporal lobe or bilateral temporal lobes, left worse than right. Pathological changes seen are TDP43 inclusions. Genetics: this type appears to have the lowest risk of an underlying genetic cause. History of dementia in first-degree family members is uncommon, and documented cases of genetic mutations are rare. This figure shows a patient with semantic variant PPA and an MRI that demonstrates left anterior temporal atrophy. This is a figure of surface projection of typical patterns of hypometabolism in this variant of PPA, predominantly affecting the left anterior temporal region. This is an example of neuronal cytoplasmic TDP43 inclusions, as could occur in this condition. Criteria for diagnosis: core features of which both must be present, impaired confrontation naming, impaired single word comprehension, supportive features, at least 3 of the following, impaired object knowledge, surface dyslexia and dysgraphia, spared speech production, and spared repetition. Prognosis: median survival is 10 to 13 years. Over time, both temporal lobes may become severely atrophic with associated cognitive and behavioral syndromes. Logopenic variant. This is the most common phenotypic variant of early onset Alzheimer's disease. Speech is hesitant and slow, mostly due to severe word finding difficulty. Articulation of words is usually intact, and patients may have islands of fluent speech between periods of hesitancy. In contrast to the semantic variant, word recognition is intact. There is repetition difficulty both for forward digit span and long sentences. The presence of some degree of difficulty in episodic memory and visuospatial skills helps to distinguish this variant from other variants. Regional imaging abnormality and pathological changes are seen predominantly in the left temporoparietal language areas. Pathological changes most commonly include amyloid plaques and neurofibrillary tangles. Genetics: the majority of patients with early onset AD have a sporadic form. About 10% have familial AD associated with one of the 3 known autosomal dominant mutations. In this figure, the dark regions show foci of greater atrophy asymmetrically affecting the left parietal and posterior temporal region, with much less involvement on the right side. Criteria for diagnosis: core features of which both must be present, impaired single word retrieval in spontaneous speech and naming, impaired repetition of sentences and phrases. Supportive features: at least 3 of the following: absence of frank agrammatism, spared motor speech, spared single word comprehension and object knowledge, and phonologic errors in spontaneous speech and naming. This is an example of an amyloid plaque, as may occur in this condition. A useful though oversimplified rule is that the non-fluent agrammatic variant is the least fluent of the 3 types. The semantic variant has the worst comprehension deficit early in the illness, and the logopenic variant has the most prominent repetition deficit. Treatment is primarily supportive. Participating in speech therapy and cognitive therapy can help to maintain language and cognitive skills for as long as possible. Other measures include alternative ways to communicate, such as sign language. Medications such as SSRIs can be used to manage behavioral changes and reduce anxiety or depression associated with PPA. In the logopenic variant, which is usually associated with AD pathology, medications such as donepezil can be tried.